Obviously, somebody that's comfortable has probably been here before.
Yeah.
All right. You know, we actually, I didn't change the lock strong enough, but he actually snuck back on in. But you know what? This is Dr. Weisenberg. This is a cool brother right here. He's actually a very, very talented doctor.
Yes,
all right.
He is, yeah.
And this is my boy over here, Dr. Barber, who's actually a fantastic teacher and clinician. He's just good. He's just good. So listen, man, I appreciate you coming on around here. We just got just basically a couple of questions for you. All right. You don't need a lawyer answering any of these questions. It's going to be all good. All righty? Okay. I like that. So anyway, you actually got a chance to participate in a heck of a case today.
Yep.
All righty. That case, I believe, was, let's say, perhaps maybe a combination of a hybrid and a lower hybrid and an upper fixed bridge. Man, what was that like doing a case like that?
It was pretty good. This is my second time coming to Core Plus, and over the time I've built up my skills and my speed to be able to assess these situations in different ways. Mm-hmm. This was the upper arch. We were doing distally angled posteriors and kind of freehanded the anteriors with immediate loads for temps.
You did a very good job for that. I was actually quite impressed. It was a very good job.
And I would say before this would have been a little bit more intimidating, but I mean, we got those implants in and secured in about an hour and a half. Mm-hmm. From extraction to flap to implant placement, and then we got our temp cylinders on, our stock abutments on, multi-unit abutments for torque down, x-rays taken, grafted all around, great closure, and a beautiful final result. And I'm absolutely stoked for it.
Excellent. You know, one of the things I like, and before Dr. Barber actually asked a question too, is for those of you out there that have heard about all-in-4 hybrid dentistry, one of the things I like about Doc's case here is we actually did a combination. First, the top was an upper fixed bridge, and the bottom was a hybrid. So this actually shows that if you actually learn how to do these types of cases, that it doesn't have to be all or one. It can actually be a combination of things. And this is the type of training type of cases that you guys get a chance to do when you come to actually Core 1 Plus with Simply Implants. So without me trying to actually hog all of the camera time here, my boy Dr. Barber over here probably gonna have a question or two. So Doc, let's let it roll.
Yeah, so I actually got the pleasure of working with Dr. Weisenberg here on a few of these big cases. And just tell me how your overall experience was in terms of, you know, taking control of a case, working through, you know, problems that may have come about, and then where you are now compared to where you were before.
Before today, or before coming to SI
course?
overall?
Yeah, no, the course. Let's say like jumping from Core 1 to Core 1 Plus.
So Core 1 Plus is really great. It gives you really solid guidelines, and I felt it really put me on a fast track. But it gives you different skills and tools. Where I really felt it got dialed in is connecting the dots here. Doing a 4 implant overdenture case went from like hour and a half, maybe 2 hours to 30 minutes. And
that's phenomenal. Yeah,
it is.
Yeah, just knowing, hey, yeah, I know what the bone looks like. I know what the dimensions are. You learn to use your pilot burr as your guide, and just dropping.
Yeah. I noticed. Not to interrupt.
No, that's all right.
You know, I noticed us doing the case. You know, big case yesterday, big case today. Your speed and your thought process has increased a lot, right? And I feel like...
What are you saying about my thought processes before?
No, you're thinking on the go, right? So like if something doesn't go as planned, like, you know, obviously we're planning everything out as best we can, but it doesn't always go...
Like altering the guide.
Yeah,
that's right.
Exactly. And talk to me about that. So what did you do? Did the guide fit okay? And what did you do
Yeah, so like the guide wasn't... And this is an issue that we kind of recognized, was we didn't have pilot burrs that were long enough to get down. In this specific guide, certain teeth had to be extracted that at one point we were planning on saving. So segmenting parts of the guide and cutting those out so we could get it to sit flushly, getting the pilot drills in as far as they could, then cutting down the top of the guide so we could get a little bit deeper, so that after we did our flap and reduction, we could still see where our pilot was, and we still had that orientation for those most distal implants.
Yeah, I think you did a great job with that, man. Honestly.
You know, I do too. You know, this is one of those questions, because I have to admit, Doc, when you first came on in, you actually were a better than average to say dentist, so we definitely recognize that right away. But let me ask you this. What do you think about those doctors that say, I don't need Core 1, let me just go straight to Core 1 Plus? Do you, after what you've seen being with us, do you usually agree with, do you agree with that assessment if somebody says something like that?
So, to give some background, I've finished 2 other full implant curriculums. And I do sinus lifts and soft tissue grafting and anterior aesthetic type work. So I do have a pretty solid background. But no, you can't really skip Core 1. It's a very foundational course, and even with a large amount of CE training background, I learned different ways of prepping osteotomies. I learned different ways of angulation. From the whole team, different ways to kind of plan things out, and kind of like what you were saying, thinking on the fly. There's just different options and how to click those variables together. And just like anything else, you have to learn it, and then you have to do it a handful of times with that backup and feedback and that conversation. You can't just hop into the next thing.
Well, you know what? I actually appreciate that comment, and I definitely appreciate also working with Dr. Barber. He's a fantastic clinician, and actually both these dudes are talented.
I gotta say the same about you guys.
Well, hey, listen, thank you very much.
It's a bro fest, but you know,
it is.
Honestly, we all
We'll be
work
hugging
well.
after this.
Yeah. We all work well together, you know, but
Yeah.
we enjoy doing what we do, and when we have guys like this here who actually, you know, are very well educated and, you know, want to learn the clinical and didactic and combine the two together, it really is a treat, dude, to work with you. And
I appreciate
you know,
that, guys.
yeah, you know, seriously, and it means a lot, you know, you coming here and saying good things about the course, because, you know, we try our hardest to teach you what we can, and you know,
particularly from somebody that's already taken so many courses before. So that, we actually really appreciate that, man.
Yeah, no, it's a hell of a good course. You're going to get different perspective from different things. I've not felt it was a waste of time or money, and that's why I've actually paid and come to the Core Plus multiple times. Yeah, I mean, take a look at the results online, and I mean, the proof's in the pudding.
Hey, listen, thank you very much again for that, brother. And we definitely like having you around.
Man,
it's the man right there.
there.
So listen, Dr. Brown, clinical director, and by the way, it's
a heck of a good
Sandra.
one.
Thank you, Sophie/Sandra's actually shooting this, so we want to give props up to her too. Alrighty. Otherwise, thank you, and look us up online, Simply Implant Institute. Come and train with us. Thank you very much.